again welcome tonight to our fourth panel as a part of the Health Improvement Collaborative panel series on racism as a public health issue. Tonight's event is on the crisis of Black, Hispanic, and Native maternal mortality. Before we begin the night, we just want to go over our agenda really quickly. As you all know, right now we're doing the welcome and check-in. Then we'll overview our group norms. We'll have an overview of the Health Improvement Collaborative and what exactly that is, followed by a story share. Then the panel, followed by a short Q&A, and then a short poll as well. The poll helps us get funding, so please stay around to take that. And here is an overview of our group norms. These are just some things by you being here you agree to, just so that we can make this space open for everyone. So let's take a look at these. And if you stay on this call, just know that you're agreeing to these norms. So now we will have an overview of the Health Improvement Collaborative by Jen.
Nikita, and thanks for joining us, everybody. I'm Jen Maggio. I'm from Ledgely Health District, which is the health department for New London and many of the surrounding towns. And we're a member of the Health Improvement Collaborative, which is a multi-sector group of community organizations, community members who have been learning and growing and working together to think about how we can each be doing work in our area of focus, but then also working across our areas of focus to advance community health. And we are particularly dedicated to identifying the systems and policies and practices that make it harder for some folks to achieve health than for others. And we see that things like that you see in the middle column there, so the social determinants of health, like education and transportation and food access, all of those things have such tremendous impacts on our health outcomes and our community's health outcomes. And we know that we can identify structural racism and the impacts and outcomes of structural racism within each of those domains. And so we are focused on addressing racism as a public health issue because of how it shows up and how it impacts health outcomes. And we are working together to identify and disrupt and dismantle structural racism and white supremacy. And so part of that work includes capacity building on our own team and in our community, and growing understanding of what that looks like with regard to particular systems and particular health outcomes, so that we can identify places where we can advocate for change. So I hope you'll join us for future events and also our regular monthly meetings. And so the domain we're talking about tonight is healthcare and racism and discrimination within healthcare, with a particular focus on maternal and infant health. And this is a slide from a presentation that we had at our, I don't remember when, April maybe, Health Improvement Collaborative meeting. We have lots of data slides that were put together for that meeting, but we're just sharing two of them with you tonight to ground us in the identification and acknowledgement that there are data in Connecticut and in our community documenting that there are significant inequities in this health outcome that we need to address. And so these data are for all of Connecticut, not just for our local area, that there were 11 pregnancy-related deaths among all women, and 80% of them were identified as preventable, and that persons of color were overrepresented among those deaths. So among the live births, people of color made up 45% of live births, but 64% of the deaths. While we don't have those data specific to our area because the numbers are small, we see the similar inequities in the outcomes. And we also see, if we go to the next slide, inequities in infant mortality. Here, our local data differs a bit from Connecticut in that for Greater New London, which is all of the 9 towns that make up Ledgely Health District, or for New London County, it was a difference that Hispanic infants had highest mortality rates, whereas for Connecticut, it was that Black non-Hispanic infants had the highest mortality rates. But regardless of which data set we're looking at, and of course, these inequities are apparent when we look at the national data too. And we know that when we look at the national data, and studies have controlled for income and education and housing status, that we still see maternal health outcomes significantly inequitable. And so we're going to have a discussion tonight about that, and look forward to our collective action moving forward. So thanks so much, Makita, for the slides. And I think that I'm tossing it to Stephanie now.
Thank you so much, Jen. Before Stephanie begins, we are going to have a little overview of the origins of American gynecology. Some of you may have heard of Dr. James Marion Sims, who is known as the father of modern gynecology. And back in 1844, he began experimenting on enslaved women in Alabama who were leased to him for these experiments without any form of consent, no anesthesia, none of that, as he attempted to be one of the first. And along his career, as his career continued to blossom and flourish, thanks to these enslaved women who were not compensated in any way for putting their bodies on the line, Dr. Sims continued to receive a lot of recognition as he served as the president of the American Medical Association, as well as the American Gynecological Society. So as Jen mentioned, and as we see some of this history, we know a lot of these issues are not new at all, and a lot of them still stand today because of how systemic these issues are. So as we continue tonight, just keep that in mind that it will take collective work to dismantle the system. And Stephanie, take it away.
Thank you. So I'm actually going to need to share my screen for a couple moments so that I can share. What I'm going to do is share a video of a local story from someone who's on this call who shall remain nameless until you see her. And she shared part of her birthing experience here. So bear with me for just a moment. I'm going to share that. It's just a little over 5 minutes. And it is as infuriating as all of the data we see, right? From the CDC, from DPH, you know, national stories of Black, Indigenous, and Brown women not being heard, being ignored when they're telling folks that something is wrong with their bodies, and you know, resulting in moms dying during birth, in recovery, after leaving the hospital. So bear with me for just a second. I'm going to pull this video up.
So it was July 16th, 1989, and my water broke and my labor started, and excited about the fact that I was getting ready to have my first child and bring a new human being into the world. We went to the emergency room, they brought me in, they put me on a gurney, checked me out, had me pushing for a period of time, and found out that my child was in fetal distress. So here we have a emergency C-section that goes very quickly. brought my beautiful son out. I got a quick glimpse of who he was, got to see him for a minute, and they whisked him away due to the fact they wanted to make sure his vitals were okay. In the interim of that time, they have decided to stitch me up, get me situated and go into the recovery room. And in that process, I had an epidural, so my back was somewhat, I was numb. I didn't feel anything from the waist down. After about half hour or so, I was laying there, I should say, and I felt this sense of pain in my back. Not real heavy yet, but just something, pressure with some pain, and I was surprised because I shouldn't have been feeling anything. So I called over one of the nurse that was in the recovery room where I was, and I told her, I said, I'm having some pressure in my back, and I said, it's painful. And she said, well, you shouldn't be feeling anything. So she goes, maybe it's, the epidural couldn't be wearing off as of yet. It has not had that much time to be in your system. It takes a while for that to happen. So I said, okay. So I just sat there and I just kind of waited. And then the pressure got intense. The pain got intense. Called her over again, and she came over and again tried to reassure me that I was feeling nothing. And by feeling nothing when she wasn't in my body, to her, based on her clinical understanding of what epidurals are to do, I guess she was just going by what she knew from the book. And I said, no, my back is really starting to hurt. Not just have pressure, but the pain is excruciating. It's starting to feel like my back is like labor pains again, like I was having back labor again. And she says, well, no, it shouldn't be that. She goes, wiggle your toe. Let's see if you can wiggle your toe. And I thought I was wiggling my toe, but evidently she reassured me that your toe's not moving. I said, okay, all right. So she went back to her desk, and there she sat. And by this time, I was almost in tears. Another 15 minutes went by. I said, my back is killing me. Please come here. And she decided to finally pull back my sheet. And when she found, what she found underneath my sheet was a gurney full of blood and me hemorrhaging through the stitches that were put in place where my C-section was. In the meantime, they're reassuring me that you're going to need a blood transfusion, and I'm slowly, at this point, fading out. Can you please sign these papers? Who can we call? And I'm slowly going out, weak. I ended up first in the critical care unit, where they gave me my last rites. I hadn't seen my son at all for 2 days. My whole sense of experience with childbirth became something somewhat traumatic. So much so that it took 6 years before I decided to have another child. The fear of that being going through the same experience again. Also the fear of not being believed or heard when I was in pain, when I was trying to talk about my body, when I was trying to talk about what I was feeling and expressing what I needed from medical professionals at the time. I wasn't heard and I wasn't believed. It's interesting how I look back at that and look at who I am today as a Black woman and see how my sense of medical attention was overlooked. And the trauma in itself has somewhat dissipated to a degree, but it doesn't leave me silent in regards to what I know I received as medical care as a Black woman, and what I was hoping to get and should have received just like anybody else, going through childbirth, and not somewhat dismissed. Why wasn't I heard?
Okay, so I learned a lesson last month where I uh, kept my video going, and then I have autoplay, so I just canceled that window so you wouldn't hear Chris Rock right afterwards. Um, so Makita, if you want to put the slides back up, please. And I want to also publicly thank Margaret for sharing uh, that story with us, and just really wanting to center um, Margaret and so many others who have experienced, right, like being ignored, um, uh, when they're saying something is wrong, right, like just you're literally not listening to me, and it could have cost her life. Um, and so as we get ready to move into our panel discussion, there's a slide up that talks about barriers to effective care, right? And this is something that came up in several of the conversations I was gifted the opportunity to be able to talk to some other moms for a couple months as we did some work with um, some students who were interning with Laurel Holmes at L&M Hospital. And so I got to listen to some other moms, and overwhelmingly, there were stories like Margaret's, right? And so some of the things that bubbled up from that was there are a lack of providers that represent and connect with folks, right? And all these other, I don't want to like read all the text off the slide, but these are some of the issues in our systems, our healthcare delivery system that create these issues. So I am so pleased to invite Cindy McMillan and Cynthia Gutierrez. They are going to be subjected to all of my questions and general nerdiness as we talk about their work, the maternal mortality crisis, and ways that we can do better. So I have your bios. I'm not going to read them. I prefer if you all would just please introduce yourselves and tell us about your work and what brought you to your work. Cynthia, would you mind starting us off?
Yeah, can you all hear me?
Yes.
Great. Well, thank you so much for this invitation. I'm so honored to be on this panel with Cindy and getting to hear your experience and all the knowledge you're going to drop on us. I want to give a special shout out to Margaret. I watched the video before tonight and it was very emotional for me. And to be able to have Margaret here in this virtual room is so special. And I'm just so moved by that. I want to start off by saying my name is Cynthia Gutierrez. My pronouns are she, her, and ella. I am currently Zooming live from the occupied Ohlone land in East Oakland, California. In terms of who I am, I'm many things. I'm a new mom. I have a son who's almost 3 months old. So I am still in postpartum. As my shirt says, postpartum is forever. I am a doula. I am a cultural strategist, a storyteller, and my day job. In my day job, I work as a program manager. I work at the University of California, San Francisco, and I manage two teams in the Department of OBGYN. One of them is called Team Lily, and we serve pregnant people who experience extreme barriers to care, such as homelessness, incarceration, intimate partner violence, substance use disorder, etc. I also manage another team called Hive, and this program is very specific to pregnant people who are experiencing and living with HIV. And I will add all their information in the chat shortly. I think another thing I want to quickly share is at the end of the day, um, regardless of the different titles that I have and the things that I do, I'm still a woman of color who is trying to navigate systems that were not meant for me, systems that were not created for me as a new mother, systems that were not created for me as a brown woman. Uh, as someone who identifies as Latina, I'm first generation Central American. My family's from Nicaragua and El Salvador, and my first language was Spanish. And so being able to, despite all the titles and the different things that I'm involved with, at the end of the day, I cannot disregard the color of my skin and how that plays a role in the care that I do not receive, and the care that I do receive in the medical industrial complex.
Thank you so much. And Cindy, please share, who you are, what you do, and what brought you to the work.
Yes. Hello, everyone. Thank you all so much for having me here. Cynthia, I am like blown away by the work that you do. It's an honor to be sitting up here with you on Zoom, of course. And Margaret, for you sharing your story, it resonates so deep. I mean, when I heard your story, I cried literally because um, I feel you. I felt you, like everything that you said is so similar to my birthing experience. Um, I'm a mother of four. My name is Cindy McMillan. Um, I'm a certified birth doula. Um, I became a certified birth doula to start out with because of my birth experiences. I almost lost my life with my daughter. Um, I waited 5 years and then I said, well, she was lonely. Let me try this again. And I was pregnant with twins. And unfortunately, with that pregnancy, I ended up losing one of my twins because the doctors didn't listen to me and I almost lost my life in the process because of hemorrhaging. Um, they didn't listen. They didn't hear anything I had to say about my medical history. And they proceeded into custody of my son and he died within several days of them giving him a blood transfusion. Um, I waited 7 years after him to actually try again. And my last two sons, they were pretty okay, but it's still um, the racism that you face in the delivery room and maternal health is something serious. And I faced it each and every time. I know the differences. I'm a strong advocate for women of color, with supporting them and supporting my community and Black maternal health. Um, I am the director of Sisters Care for Sisters, which is a community-based doula program for social justice in Asheville, North Carolina. We focus on a lot of different things. Doula work is our primary focus, but we also do postpartum support. We do lactation consulting. Um, we do clinical shift policy change and capacity building within our community. Um, we are we have just became our own nonprofit when we started out as a program. So now we are in the final stages of our nonprofit formation, which will focus on the whole family unit of pregnancy with moms. What we're structuring is a place where moms can labor and without going to the hospital for medical interventions that can lead to these potential unnecessary medical procedures that create the outcomes that are actually affecting our moms. It seems that when they go in sooner, a lot more things happen that's unnecessary. So if we provide a space for them to labor and then gets them to the hospital when it's time, they can have time to be with us doulas in a family-centered environment where we can all be together and get through it. And on top of that, since COVID, we've faced a lot of homelessness with our pregnant moms here in Asheville. So what we've decided to do is structure this housing where our moms can stay there for up to 3 years, and we set them on a pathway to success. On this pathway to success, they will have the ability to obtain home ownership if that's what they're seeking, affordable housing, education, further education, childcare, employment, all the social determinants of health situations that are affecting our community, we're hitting them head on. I'm like Cynthia, this system was never meant for women of color. We have to we're actually combating a system that is really difficult to navigate. But once you're in this work, there's no like, there's no backing down. We can't turn our head. We can't be silent anymore. I think the advocating is the biggest. This is the love I have for the advocating, because to sit here and actually can tell someone that you're wrong, the way you're treating our moms, the way you're treating our families, the way you're treating women. I mean, we give life in a sense because I mean, a lot of moms, the first time in my community they ever go to the doctor's office is when they're pregnant, because that's when they have to, and because there's no trust, and then they have to trust you in some sense, and they don't, and then you break that trust by harming them, harming their baby, harming their body. That's just it's it chokes me up. And I breathe this work. You know, when I'm out here, this is my life's work. I went to school for audio engineering. This is a whole different path from my music or creativity that I thought that I would be doing right now. Um, but this gives me life. Um, I do have a really good team behind me. We are the first doula program that's embedded in the medical clinic. So we're fighting in the system. We can't fight on the outside. We're actually in the clinic to watch our physicians and see how we can work together to make this right. We focus on the racism, and it's openly discussed. So we have to do this as a unit. Um, and that's how the clinic that I work for or work with, that's how they view it too. And we have a lot of support with the residency program, because we feel like this is a team effort. We didn't get into this situation by ourselves, you know, so we have to actually build some type of relationship and get everybody on the same page with us to actually combat the problem of showing respect and having our moms feel valued, heard, and seen when they're delivering in our hospital settings, and in our clinical settings when they're being prenatally cared for, postpartumly cared for. Um, I think that's
Thank you both so much for sharing your stories, for sharing your work. I don't know if you have been seeing the chat. People are like just shouting y'all out, and now I'm hopeful that everyone knows. Like I've been bragging about the two of you, just based on our individual conversations for like a few weeks now. So I'm pretty sure after just answering that first question, everyone understands why at this point. So thank you both. And I'm just so inspired by all the stuff that you're doing. So thank you. So we just, saw Margaret's video. Cindy, you shared your story. Um, there are national stories that we hear about, right? Like a mom goes in to give birth, and only the baby goes home, right? Or all of these sort of like heartbreaking and infuriating stories. And so if you all could talk about what, in your opinion, can be done to mitigate these infuriating, tragic, and unnecessary losses, please just share what you think can be done for that.
Yeah, I can start off a little bit, and maybe Cindy and I will just go back and forth or have some maybe even similar thoughts. I want to start off by saying I feel like for me, the personal has always been political. And so much of these questions, I just have personal experiences. So I want to briefly share that and then kind of get into like the macro policy changes as well. Um, I Something that Margaret was saying over and over again that just like could not leave my mind is the nurse was saying, you shouldn't be feeling anything. I'm going to say that again to you all. You shouldn't be feeling anything. I'm going to say it one more time to you. You shouldn't be feeling anything. And so when I heard that, I was so moved because although those words were not said to me, it's the lack of common respect and communication that I experienced in my own birth almost 3 months ago. was present for me. I had a situation where I advocated to have my doula there with me. I didn't care what paperwork I had to fill out, who I had to talk to, what manager had to know. I remember going into triage and was told I was going to be sent home. And I said, nope, you're keeping me here. Like, and that's just because I'm naturally very outspoken. But like, when the pain increased and I no longer had the energy to like yell for myself, I really had to lean into my community, like my doula and my partner, to say what needed to be said. There was a point in my own birth experience where I was experiencing pain right after my son came earthside. And I kept telling them something's not right. Like, you have to feel this. Like, I couldn't even get him to latch because I was screaming from pain. I started losing consciousness. It got to the point where my husband started crying. He didn't know if I was going to survive after my son was born. I briefly remember telling my husband, like, if anything happens to me, like, you know where all my things are. I was so out of it that I was like, the things that I have, like, make sure he's taken care of. I don't even know like what exactly I was saying, but I knew that because I was so in and out of consciousness, that I didn't trust these people to like keep me safe and to like keep me alive. And so I said what I had to say as like somewhat of like parting words in case I didn't make it out of there alive. By the grace of, you know, a creator, like I did make it out alive. And I'm thankful for individuals like Margaret and Cindy that are here with us today as well. Um, but it makes me think around that it should have never gotten to that point for me. It should have never gone to that point for Margaret. We need to listen to Black women. We need to trust Black women. We need to believe Black women when they tell us anything about their medical care and overall well-being. Um, when I think of like what can be done at the policy level, so as I mentioned to you all, I work at UCSF, and my office is like stationed at the local county hospital. And so we get mostly patients who have Medi-Cal here in California. And I have had the honor of doing postpartum surveys with individuals just to ask, like, how was everything? How was your birth? How was the staff? Like, just let me know. And I often get these remarks around like something felt off about the care team. Like, they would tell me, I can't tell you in words like what exactly they said to me, but it was their energy. Like, they looked at me a certain type of way. Like, people have told me like I felt disrespected. They didn't outright like call me out my name, but something in the intuition or the gut was like, I don't feel like I belong here. And there's this perception that because I work in San Francisco and we're so liberal and we're in progressive California that no one would ever do anything racist. I think calling someone racist or telling them that they have white supremacy tendencies is like the biggest insult you can give, you know, well-intended white people in the medical field here in San Francisco. It's like you calling their mama out on something. Like, it's like the biggest insult. And so um but individuals will say like I was treated with a certain tone, or like I wasn't offered all the services, or you know, something that is a huge concern here in San Francisco is the child welfare system. If I reveal too much, will my child get taken away from me? Um, how much can I disclose to this social worker because I don't trust that they have my best interest in mind? And often, being in the county hospital, we have mostly families of color, people of color, and a lot of the practitioners or the healthcare team members are white. And so I'm constantly telling people, like, you can have the best intentions in the world, but that's not the impact that people are feeling. They feel other. They don't see a provider that looks like them. Of course, not all, you know, skin is kin. Like, you know, we can't just be saying that every person of color has my best interest. Like, that's also not the reality. We also have to dismantle the ways that class privilege shows up for some individuals that hold certain titles in the medical industrial complex. But at the end of the day, not only is representation important, but having people that have that lived experience, that are able to come from the communities, that are able to really listen with empathy, and have the best interests of the patients, the mother, the birthing person, whoever it is, and really move in that direction.
I second that. I amen that. I amen that. I also look at it like this. Racism is real. I don't care on any fronts. Like, people can say what they want to say. When you have a profession, when you raised one way and you bring that what you raised into your profession, it literally follows you into your profession. It follows your biases, follows you into your profession. And I'm gonna give you an example of how that happens. Sometimes it happens unintentionally, and sometimes it happens blatantly. I was supporting a mom of mine, and we went into the the, the triage. She was just going into labor. Never ever been asked this question with any of my other moms before, but she was young. She didn't have her partner with her, and the first thing came out of the nurse's mouth was, "Who's your baby daddy?" They have never asked that, as long as I've been a doula, asked a client of mine that type of question. You know, when I was pregnant and I hemorrhaged and I was hemorrhaging on that bed, the doctor came in to me and she told me, she said, "Cindy, if you don't stop bleeding, you're not going to make it." As if it was me that was causing the problem as to why I was hemorrhaging. You know, whether it was she was thought it was funny, whether it was however she wanted to frame it, at the end of the day, it happened, and it caused a lot of feelings, a lot of hurt. And when you get treated as less than, and that's what I felt like. That's what my client felt like. Like, as soon as that nurse left out of there, she started crying, and that nurse had no idea how she hurt her feelings. But me being a doula, I let her know she hurt my client's feelings. I'm an advocate for mine. And that's the space of sitting where I sit. Sometimes you can advocate in a way that you're not out to be the security dog or the watchdog in the room, but you're the one that's calling it like it is. Like, that was really inconsiderate. Would you do a white mom like that? If one of your white patients came in here, would you treat her like that? And sometimes it takes that to make them think, or it takes that to make them trigger off to be like, you know what, she's right. But the way the system is set up is allowing these things to happen. When they're teaching in medical school that Black bodies don't feel pain, this is taught in the medical schools, we have a problem. We have a problem. We have a serious problem. And it's something that they will not retract because it's still being taught. So we're taught that we have a different type of pain tolerance. The only thing this education piece that they're teaching right now, it has pretty much saved us from this opioid crisis, because they ain't trying to give no Black folk nothing for pain, But it's still, at the end of the day, it's false narrative. It puts a spin on us. It makes us look like, they can do whatever to us and to our bodies, and we don't feel it. I've had several moms who've gone in for cesareans and been cut and felt every last cut, but they didn't numb them. And then by the time it's over with, they're scared because they don't want to say anything. And that's when they should speak up. But that by that time, the fear is instilled. So it's a lot of things within policies that we really need to like dig into in these books, the way the education piece is taught, how racism showing up, how it's so prevalent. I am thankful they declared it a health crisis, because it is. We all deserve health care. We here. How can a society function without its people being healthy? How can society function without these kids being healthy? We can't. And until they grasp that, which, capitalism, money, it all runs hand in hand. In my eyes, they get paid off of this very well. off the destruction of the Black body, but that's my theory. I watch it, I see how they profit, but it's still got to stop because it's too much harm being done. And where I sit, I'm not gonna sit still and I'm not gonna be quiet. I'm an advocate for it. You know, I'm not saying I'm an advocate, I'm a strong advocate. Um, I heard someone in the chat ask how do I get to work with the clinics, how I kind of how we set that up. And we set that up because you need a clinic to be on board with changing some of their things. You know, you can't, a lot of clinics ain't down with it. They're not down with changing up some of their policies and changing up some of their stuff inside of their clinics. But if you find one that you can actually sit down and talk to and show them the benefits, because our clinics see the benefit of changing up some of their nonsense and the crap that they was doing before, prior to. They see that they getting more moms, women of color coming to their clinics. They see that the doulas creating trust. All their doulas are trained with different modalities that we're able to like get them in there to be seen, not just for pregnancy, but a lot of our moms going in there to get health care now, like to actually be seen for other illnesses and things that they don't know about. All that's important. But if you don't have a system that we can trust you, that you're not gonna harm us, we're not coming to you. But we do need representation in these clinics. We need to see people like us that we can say, oh, you know what, that's a good doctor right there. I've worked personally with this one. He has a repertoire of taking care of you. But that hasn't been represented in a lot of areas. So people just, there is no trust. There is no trust.
Stephanie, can I quickly add something?
Yep.
You know, one thing that what Cindy was saying made me think of. So I work at a university, but it's affiliated with a hospital. And one thing that I've noticed come up, because everyone is really into DEI work, diversity, equity, and inclusion. That's like the latest buzzword. And everybody wants to be a part of the committee. But often in these spaces, as an employee, so I am mandated, I believe, to take 1 2 hour training a year. So it's like these digital trainings where they give you all the definitions of what's bias, what's implicit bias, what's racism. And so you sit down there, I mean, someone could easily not be paying attention and just fill in whatever answer they need. They don't have to take it seriously. You complete it, and then it shows up in your kind of employee portal that you've completed this criteria. And now in the hospital university's eyes, you are deemed as someone who is does not have bias, and you're out to be in the world and protect people, which is clearly not the case. And so one of the things that, you know, I've been thinking about, what does it mean to consistently train people, everyone from nurses to doctors to security to people at the front office, not just once a year, and training them in different topics such as harm reduction, substance use disorders, what it is like to be able to interact with people of diverse and different lived experiences. And to also add to that, you know, I've seen people act in ways in hospital settings that I find truly disgusting. But the reason that they're still there is because they're never held accountable. People are scared to say something to them because maybe they have seniority, maybe they're everyone else's boss. And the way that sometimes, you know, these city jobs, these county jobs, hospital jobs, you can get maybe written up once, written up handful of times, but it's really hard to fire someone unless you've done something that's so explicitly bad that it brings like, you know, horrible PR to like the hospital or department. And so I think that's how certain individuals are able to just slide under the system, because they are not held accountable, and maybe they're sent to another hour, 2 hour training, but that doesn't actually change hearts and minds. They're still a part of that system.
Okay, so I had another question that you all just organically answered. It was about right, the medical training that is happening, right, and the Eurocentric curricula and all those things, right, and like sliding in a little, module about equity and cultural competence. So you guys answered that. I knew that was going to happen. All right, hold on, because there's another question in the chat. I have some other questions, but I am happy to go here. Question for either of you. Seeing capitalism is going to be here well after our time on this earth, how do we access hope of things changing at the macro level?
I say having organizations like what we're developing, that actually care for the needs of families of color. I say it all the time. You need, and Cynthia stressed it several times when she spoke, having people look like you that actually care for you. You know what I'm saying? That's actually in it, not for the financial gain. It has to be a deeper level, and you're only going to find that from community. You will find that from lived experience. When you've lived rough and you've had some trauma happen to you, it will move you in a way that you would never want that to happen to anybody else. That's the power of trauma. You know what I'm saying? So we may live in this capitalistic system, and it's kind of messed up. That's how it is. But there hasn't been programs out here that look like us, like these types of programs that actually focus on the supporting of maternal health. I think it should be a doula for every actual field myself, because you just don't know, like someone going for heart surgery who had a really bad experience could actually use this type of support. This support, this support is like, it's unreal. The emotional, physical, evidence-based information, just giving them everything, giving it to them raw and uncut so they can make sound decisions, accurate decisions about their health care, and then having that person that they're giving it to listen to them. It's transferring of information. It's being there to support them when they probably feeling at their lowest and so confused, because it ain't easy to understand what these doctors are talking about if they're talking over your head, and most times they are. So, I mean, this field could actually be utilized in so many other areas, as I'm learning and I'm realizing. But when I had my kids, I didn't have a doula. I didn't even know what a doula was till I became a doula. So this wasn't something that was just out there like, hey, you guys want a doula? Hey, we got some doulas over here. This wasn't in my hood. We didn't know what it was, and then when you go back and listen to the terminology of a doula, this was a luxury service. Definition of female slave. You know what I'm saying? This wasn't even designed for us at one point, but we taking it back because this is what we was doing back in the day. I've been a doula since before I knew I was a doula. I brought in my friends' kids. I coached them through it because what I went through, I was always in there with them. Yo, I'm watching you. I got your. I know this is a profession. This is real, and it needs to be taken as such, because I don't know if you feel the same as Cynthia, but I feel like I'm that extra eye in the room. I'm that extra ear in the room. The things that they can't hear, I'm here to translate for you, boo. I got you. You don't got to focus on nothing. I got you. I'm taking notes. I got you covered. So if they give the power to where it belongs to the community, that let the community support the community. We know our needs. We know where we fit in, and let us do it and support us. Give us that leg up. I look at our clinic every day. They gave us the leg up. They gave us the back to stand on and let us just stand there and do us. They not in our face. They don't mess with our program. They don't manage nothing in our program. We do it all. They just the legs that we stand on to get the job done. And that's what more companies, more hospitals, more clinics should do that. Give the community some power. They don't want to give up that power, but give it to them. You'll go a lot further.
I really want to respond to what Cindy was saying, because so two things. The first thing is, in my day job as a program manager, one of the things I take a lot of pride in is care coordination with our community-based doulas and with the clients that we have here in the hospital. So I'm going to put a link to one of the doula groups that I work with really closely. They're called Sister Web. And what makes them phenomenal is that data in San Francisco was showing that the individuals that needed the doulas the most were part of the Black African American community, Pacific Islander community, and the Latinx community. And so they actually get doulas from those specific racial and ethnic backgrounds from the community. And then we link them up with Pacific Islander, Black, African American, or Latinx, Latina patients. And so I actually was in a meeting today where I'm trying to figure out like, what are the barriers to care? And often the barriers is that the care teams in the hospital don't recognize doulas or birth workers as part of the care teams. It's always like, oh, that's something extra. Like they wouldn't talk like that about a public health nurse. They wouldn't talk like that about another social worker. And so we have to be very intentional. And when I say we, it's myself and like other people to continue bringing up doulas in the room, and explaining who they are, what they do, because there's not a, despite everything that's on the internet, and it's very easy to like Google the role of a doula, there's still so many people that don't understand it, which to me is confusing, but to each their own. So I think that's really important to say, because we need doulas that are part of the actual communities that are being served, that live in the neighborhoods, and that's really important. We recently had a doula that has returned for one of our mothers a second time because she had such a great experience the first time. And so to be able to be like, I want my same doula, like, please connect me. It's so phenomenal. You know, one final point that I want to make is, and I think one of the questions will go to this is around what has my journey been like as a doula, and one of the things that I've done is I've been a volunteer doula at one of our local hospitals, particularly for monolingual Spanish speaking mothers and families. And so meaning that Spanish is their first and primary language. And I cannot tell you like how many times I've had care teams in that hospital um, not want anything to do with the doula, but they have no problem asking for free translation. So part of the services that are equipped in the hospital is that there's a translation phone. So if you don't know how to say something, you don't feel comfortable saying it, you can call the phone, you can use the phone and have that translation done for you, especially when it comes to like medical terminology, which is like really problematic to like try to guess on the spot what the translation is. And so I find it very problematic that I've had situations where people don't want a doula there because they think they're interfering with the nurses or the care teams, but they love the free translation services. So we have to be mindful of like how those power dynamics and those things play out.
Yeah, those power dynamics do play out. And I know that it's a trick to it. It's like you have to kind of maneuver around the system because, like I said before, doulas has been a luxury service. So when you have doulas that come in and they do their thing because they're getting paid thousands of dollars to do their thing, they do disrupt the nurse's life, you know, because they got to cater to their clients. They're getting paid to cater to their clients. Community-based doulas work different. We're on a different type of mission. We're not seeking the compensation. Our compensation comes from elsewhere. Our focus is the mom. So when you start framing that to, and it's just a tip, when you start framing that to the hospitals of your benefit to them, and your benefit is, hey, I'm gonna be here with her. That frees you up to go handle that mom over there. When we need you, we'll call you. You don't have to worry about her. I mean, if anything go on in this room, I mean, we go to the point where we work, and it took a year. It took us 5 years to build this type of relationship with the nurses in the hospital. But we work as a team. We go in there with our moms, we help them make their beds. We give them their water. The nurses get so comfortable, they be like, oh, you just come out there and get us when you're ready. They give us the free ring, but because they know we're not problematic, we're not there to try to take over and try to make decisions for our clients. We're explaining things. They seek answers from us. Well, do you need more time? But you have to promote it as a way that you're not in their way. I'm not in your way. I'm here for her. If anything, I could support you. If anything, I can make your job a little bit easier. I know you got like 5 or 6 clients over there, girl. I got her. You go handle you. But they have to see that because it's so many doulas in this world. And when they operate, and if you see the ones that's private doulas, they operate totally different from a community-based doula. And that's where the doctors and the hospitals get a little iffy with us because they don't know where you sit and what you're about. But always make it clear when you in that room what you're about. You ain't about trying to make their job no harder, and you ain't trying to make them do extra work. Um, and I promise you, I think some of those things would change for you. I promise you.
Thank you both. I'm sorry, I've been actively listening and completely geeking out at the same time, just at all the things you're saying. So we have actually had over the course of the last few weeks, like people inquiring about like the process. And I know that Cynthia, you talked about it some, like your journey to becoming a doula. So a couple things. Connecticut very recently just passed sort of this omnibus bill called SB1. And there's like a lot of stuff in it. And in it, like they define the doula profession, which I find interesting, right? Like we need you to define what they do. I just find that interesting. And so I don't have like all of the language from the bill, but I'm curious about what your journey is, and thinking about like whether or not the process, like the certification process, is another barrier, right, to being able to have like these positive health outcomes. So anyone, either of you.
Yeah, no, that's a lot of questions. So let me make sure that I can answer them all. But I think it's first of all important to share why I became a doula, because I know that we all have like different ways that we went about this. For me, like I've always been involved in different social justice movements or causes since I was a young person, and so advocacy was something that just came very natural to me. In 2014, I was working in Santa Cruz, California as a prison project director. And so I was working at a nonprofit where I was going into California state prisons, jails, and juvenile halls and was providing like cultural and educational programming, mostly to men, to lifers. Often they would refer to me as like their grandchild because there was such a huge age difference. And because I was doing this work, I wanted to be able to like connect with kind of the feminine energy, wanting to be able to connect with more like local groups. And so in the little spare time that I had, I volunteered as a writer, a creative like writer for this program at the local Santa Cruz County Jail. And so I would go in weekly and we would do poetry workshops and writing workshops. And I would work with the women's unit at that jail. And one particular day, I had given them their prompts and people were writing. And I noticed that one of the participants was visibly upset. But I'm always the type of person, like I'll tell people, like, I'm here if you want to talk. I'm not here to like push anything. We don't even have to address it, just letting you know that I'm here. She finally looked me straight in the eyes and said, I just found out I was pregnant, that I'm pregnant. I asked the guard for an extra carton of milk and he declined. He said I did not need that extra carton of milk. And in that moment, I just felt like my entire body just stopped. Like I felt like there wasn't enough air in the room to breathe. And I had to compose myself because I had like could not believe that this was told to her. And so, gave her whatever support that I could in that moment, and was determined once I left that class that I was going to do what I could to like advocate and figure out what kind of services that she needed if she was going to continue with this pregnancy. Um, and that there have been moments in my life where I truly believe like I was at the right time. I was in the room at the right time, in the right moment. And though that was one of those moments. And so I instantly wanted to know, what could I do about this? Like I just could not believe this is happening. And so I started doing my research, and that's what I learned what a doula was. That's when I started learning that people who are pregnant and who are experiencing incarceration are being shackled while they're giving birth, that they're not giving just basic health care, whether they're wanting to obtain an abortion, whether they are wanting to get prenatal vitamins, whatever services they need while incarcerated. And so, again, divine timing, because at the same time, the California Latinas for Reproductive Justice, they were having a training. I didn't know what reproductive justice was. I was so involved in the criminal justice sector that I applied for this training. I ended up, getting hired by them as a consultant. And like, you fast track years later, um, I realized that we don't live these single issue lives. Like, we are not just in this case, like it wasn't just like someone was incarcerated. They were also a person of color. They had also shared that they had a substance use disorder. And so all these things are intermingled with one another. Um, I was able to, in the beginning of my doula career, was able to volunteer at a local inpatient residential program where women were with their children and um, trying to either be in recovery, stay in recovery, and meet whatever criteria that the courts has set out for them. And so that was a really life-changing experience for me. I am someone that has gone through different trainings to become a doula or quote unquote certified doula. I will say that the first training I went to was incredibly boring. And I couldn't put my finger on why it was so boring. And then I realized because it was so technical. For lack of a better word, it was by a white instructor. The room, Santa Cruz is a mostly white town. And so I was one of the few women of color. I had received a scholarship to go to this training. These trainings, like a minimum, they can be anywhere from like $1,000 to like $1,500 to up to $2,000. I mean, they can exceed depending on how many classes you take. Some trainings are only like for the birth. And so if you want to learn about postpartum, that's another grand or more than $1,000. If you want to learn to be a childbirth educator, that's like another fee to pay. And so I was not stimulated or felt like I learned a lot at all in that training. And so I was like, what am I missing here? And this was a moment where I, again, divine timing, I was connected to an indigenous midwife in the Central Coast. And she was like, I'm having an indigenous like birth training, like please come to it. And so this is when I realized like it's one thing to learn the technical aspect of like what it means to like have someone go into labor, prenatal care, the postpartum period, but it's that cultural relevant part of it that was a game changer for me. And so being able to continue taking classes is really important to me, to have a critical lens in what I'm learning. For me, it's really important to find trainings that really center people of all lived experiences, that have disability justice as a component of it, that has birthing people. It's not always just women who have children and babies, and I try to be just inclusive of different experiences like that. And so I find that a lot of these trainings are held by white institutions. There are trainings by incredible organizations like Ancient Song in New York. There's incredible trainers in the South, Black and Brown trainers. I mean, it's there. It's just a matter of finding them and working with them and compensating them. I think often I've heard people devalue BIPOC trainings in comparison to these bigger white organizations like DONA that are more well known and quote unquote more prestigious, but like to each their own. I personally now appreciate getting trained by people who have like that cultural relevancy, that cultural rigor. That's very important to me. And I think that these trainings are truly a gatekeeper for people who cannot afford to be able to do the trainings. I know individuals who have had children of their own, who have been auntie to children, who would be a way better doula than someone who has gone through like 20 million trainings. And so it's how do we balance that lived experience with that educational component? Um, yeah.
Cindy.
Ooh, she hit it. She hit the fire at that. That that is so real. That is so real. And I said because I'm a certified doula through DONA. And that was the doula training that I was offered. And I know it was hard for us to when we got offered to get taught to be doulas. It was 6 of us at the time. This is the training that they presented us. And when we walked out of there and we started doing the work, we had to actually retrain ourselves because it didn't fit. It didn't fit for our community. It was like we had to restructure the whole training. Um, we're certified, but hey, we had to make it fit for our community. And so now I'm a doula trainer. I train and I teach it my way. And I'm a childbirth educator, but it's right. It gets as you go further along, it gets more and more expensive, and it's like um it gets a little out of hand. So I would say we need more women of color, professionals of color that's doing these doula trainings and getting it because there's so many women that wants to be there's so many individuals want to be doulas. I even ran into a couple of gentlemen who would like to be doulas. And I'm like, I'm down. I could see it. I could see it, doulas for dads. I could see this. I could see this happening. Um, but there are a lot of barriers. It's like the financial barrier is the biggest one because you do have to take a lot of classes and they come out of your pocket pretty steep. And then they want you to like kind of build a professional career or a business around what they teach you, but it don't often work out that way when you're focused on your community. Like when we started, when I started, it was the infant mortality rates and the maternal mortality rates that did it for me. It was like I remembered my lived experience, and then here in 2016, 17, that these rates are the way that they are. These numbers looking like this. This has been going on like too long, and it's time for it to stop. And there's a skill out here that can actually support the outcomes to be different. Like, and they haven't been giving this to us women. They've been like kind of holding back on something that could actually been saving our lives, giving us life-saving information. I felt like that was just grimy. I just like that was just grime, you know. And so um yeah, I felt kind of betrayed by that because the skill is so. I mean, I don't know if everybody on this call like really have been supported by a doula, know what we do. We bad. We bad. We do our job very well. We with fire, and we go above and beyond. I mean, it don't even feel like work, honestly, for me. I don't know about you, Cynthia. It comes so natural. It's like I get excited. I got a birth coming. Woo! Let's go. Today, tomorrow, it's always an adventure, and you see a new life being born, and you're supporting, and the mom's happy, and her outcome is happy. So yeah, I think we should actually uplift Black birth workers and Black people, women of color who out here doing this work and teaching, and stop, keep feeding it to these institutions that's been around here for so long that ain't really benefited nobody but them, their pockets, and in a sense. The statistics show they they numbers aren't suffering like our numbers are suffering. So they good in a sense. They straight. We're not. You know, sometimes you got to reach down and help and support the ones who are suffering. I don't know if you've ever experienced trauma in your life. It ain't great. It ain't great. It ain't great. And I move heaven and earth for some my moms not to experience some of these things that they have to experience in maternal health, being in this healthcare system. We're an advanced country, and we got the worst maternal health outcomes. That should register something with people. How we got people on the moon, but we can't deliver a Black baby right, a woman of color baby right. That's not that's no, that's not right. That's not right. Mm-mm.
So my cup runneth over, y'all. Um, I wanted to ask either of you if you have like a final thought that you would like to share with us. We are nearing the closeout time. I am so full. And if either of you have like a final thing that you want to share with us, we are all ears.
I thank you guys for listening. I have fun. I did. I had a blast. Anytime. I would love to get with Cynthia though, out in Cali, you
We'll
see.
be chatting all day long.
Learn, yeah. Seriously transfer some information because I like that. I've been out there a couple of times, so speaking
Well,
at conferences. So yeah.
Oakland, this pandemic. I will say this though, the pandemic has really exaggerated already existing issues in these institutions for mamas and birthing people. Um, it's for me as like someone who had to give birth in a hospital, uh, was extremely frightening to have to wear a mask and be scared my entire pregnancy if I was going to get COVID. Like, I want to make
Mhm.
it really clear. In California, the restrictions in terms of like social distancing and masks have been lifted, but the pandemic is not over. We are still very much in a pandemic, and we need to continue supporting birthing people, families as much as we can. One of my deepest passions is supporting families, particularly in the postpartum period. I think we often have baby come and we completely forget about the mother and birthing person. It becomes all about the baby. And the 6 to 8 weeks that is quote unquote provided as a time of healing is not enough. We need to continue showing up in ways that are safe in a pandemic. Not every new parent is comfortable having the whole block be showing up at their house right now. But how do we get creative in terms of supporting people, whether it's with like digital gift cards, whether it's being able to provide healing circles. One of the things that have been so helpful in my postpartum period is having a closing ceremony. I had an indigenous closing ceremony, a womb massage, and to be able to get back to our cultural practices, whatever that looks like, connecting with our ancestors, connecting with community and the way that feels safe and comfortable in a pandemic that differs for all of us. I think is something that we should continue encouraging each other to do. Um, we should pay for people to be doulas for others. Because I did not have a baby shower during the pandemic, I told people this is my Venmo account. And if you want to help me pay for my doula, pay for a woman of color to be my doula, pay for a woman of color to be my postpartum support. And that's what they did. So we need to continue making these services available to people because that's what we need right now.
Thank you. Thank you both. I could legit sit here and listen to y'all talk all night. This has been so good for my soul and my spirit. So yeah, I mean, you can see in the chat. This has just been absolutely amazing, and I'm gonna stop rambling now because I'll just text you both afterwards. And I'm gonna kick it back over to Makita to walk us through the remaining part of tonight. Thank you both again so much.
Thank you, Stephanie, for your amazing moderation. Thank you, Cindy and Cynthia, for your wisdom. I learned so much tonight, and I will also be hitting you guys up afterwards. So expect that message from me. And before we wrap up our event tonight, we did want to share some progressive happenings that are going on right now related to the topic. So we have the Black Maternal Health Omnibus Act of 2020, which is a bill that basically directs many different US agencies to address the maternal health outcomes among our communities. And we have a Senate bill that has been proposed this year titled An Act Concerning Doula Certification and Medicaid Reimbursement for Doula Services, which is one that we talked about a little bit earlier, as well as a Yale study on Black maternal health. So that's going on right now. These are things that you can stay updated on as we continue to get more information on them. And finally, we have some next steps for you all to take, as well as our poll that I mentioned earlier. So of course, you can support legislation. You can attend our next equity panel on food justice in 2 weeks on June 30th. And you can build networks of support for mothers and their families. You know, we mentioned tonight how important community really is for mothers and their families during this time and throughout their lives. You know, as Cynthia mentioned earlier, postpartum is forever. And I think that's really beautiful to hear because it's true.